Well, I am thrilled to be here. I just want to thank the Dysautonomia Project for inviting me and for putting together this course. I know this is the first time that this particular course has been done, and I'm just so excited for the vision behind it, both the educational aspect and the support. Let's dive in and get started. All right. These are my disclosures. So I'm going to be talking about tools for managing autonomic disorders, kind of just introducing this course here. This is the outline of our brief journey we're going to have over the next 45 minutes or so. I'm going to do a little bit of introductory statements about the autonomic nervous system and autonomic disorders, just to kind of give us all a little bit more on the same page, depending on kind of what your level of experience is. Then I'm going to put together what I think of as a framework for approaching autonomic disorders, trying to focus on it mainly from the patient and caregiver side. And then we'll spend a little time doing an overview of treatments of autonomic disorders. So, what is the autonomic nervous system? Well, the autonomic nervous system is the part of your nervous system, meaning your brain, spinal cord, nerves, that is responsible for maintaining homeostasis in the body. Every moment of your existence, there's thousands of biochemical and physiologic processes going on to keep your body working, and these require really precise conditions: the right temperature, the right amount of blood flow, not too much, not too little, the right amount of oxygen and carbon dioxide. And the autonomic nervous system is what is responsible for keeping all of this constant in the face of external stressors, changes in temperature, changes in your activity level in the body. So it's keeping everything inside working. It's not under voluntary control. And in fact, if it's working properly, you're not even aware that it's working. That's why when things go wrong, you start to become more aware of it. It's automatic. It's always on. It has parts to it. So you've probably heard of your sympathetic nervous system, known as the fight or flight system. So it's not just when you're getting chased by a bear. It's any time you're trying to rev up your activity level or deal with external stressors. The parasympathetic system is kind of the opposite. This is your housekeeping system, your restorative system. I'm resting, I'm absorbing my nutrients, I'm repairing my body. Then, don't forget, there is the enteric nervous system. So this is the nervous system of the gut. It takes a surprising amount of coordination to go from your mouth all the way through your gut for the food to move, to get broken down, to get digested. And in fact, there's as many neurons in the enteric nervous system as in your spinal cord. So it is its own brain all to itself, really. All right. So then what happens when things go wrong? This is a pretty important system. A lot can happen if things are going wrong. So this is a survey of symptoms that can happen when the autonomic nervous system is not functioning properly. Certainly not everybody experiences all of these symptoms, but they may include orthostasis, or feeling unwell while you're standing because blood flow is not happening appropriately to your brain. Syncope, which is the medical term for passing out or fainting, again, because of lack of blood flow to the brain. Exercise intolerance or fatigue, palpitations or tachycardia, the medical word for a fast heart rate, dry eyes, dry mouth, changes in sweating, a variety of different symptoms in the digestive tract, bladder problems, and sexual dysfunction. So pretty much any organ system in the body can be affected if the autonomic nervous system is not working properly. I'm going to take just a moment to try to disambiguate a little bit of terminology. So the word dysautonomia is used in different ways by different people. So first of all, dysautonomia is not a specific disease or diagnosis per se. It's often used to refer to a constellation of autonomic symptoms. Something is not right with the autonomic nervous system. And sometimes we can make a more precise diagnosis and we say, okay, this is what is going on and this is what we call it. Sometimes We're not entirely sure about the precise disease process. This is still a very active area of research, but dysautonomia can be used as the descriptive term to say that the autonomic nervous system is a little off, and we can still treat a patient and treat their symptoms with that. Autonomic failure is different and a little more specific. That indicates that the autonomic nerves themselves are damaged or dying, and there can be frank failure of autonomic functions as opposed to imbalance. So if you hear these different terms, that's kind of why there may be a little bit of confusion. And sometimes you just got to ask people, what exactly do you mean by those terms? But I will use dysautonomia fairly broadly here to refer to a variety of autonomic symptoms. All right, so what can cause autonomic dysfunction? Well, a lot of things, actually. We are certainly not going to go in depth into these, but I think it's helpful to get an idea of a survey of the different processes that can affect the autonomic nervous system. There can be neurodegenerative conditions. These are ones that cause frank autonomic failure. The autonomic neurons die, and it's mostly Parkinson's disease and related disorders. Injuries of a traumatic or structural nature to the spinal cord or to the autonomic structures in the neck can cause autonomic impairment. Very common conditions like diabetes. Diabetes is one of the most common diseases just in general in the country, and diabetes can really impact the autonomic nervous system. There are some very rare inherited forms of autonomic dysfunction. There are autoimmune conditions that can affect the autonomic nervous system. Some of them are very rare and very well characterized. And then there's a very active area of research looking into the crosstalk between the immune system and the autonomic system and how those two might be working together or in opposition to each other. That is not well understood, but a very active area of research right now. Then there's POTS, postural orthostatic tachycardia syndrome, one of the most common autonomic conditions out there. And then going along with that, more broad forms of dysautonomia, very similar symptoms to POTS sometimes, where patients may not meet the precise research criteria, but have a lot of the same symptoms. And then there can be episodes of autonomic dysfunction or kind of an overactive autonomic reflex, such as vasovagal syncope. So a huge gamut of different disease processes that can affect the autonomic nervous system. All right, so why are autonomic disorders so challenging? Or as Dr. Goldstein likes to put it more succinctly, why are dysautonomias hard? Well, I think we've already gotten a little bit of a taste of that. The symptoms, the presenting symptoms are diverse and non-specific. Any one of those symptoms, several of those symptoms could be caused by many other diseases. And it can take a very long time and multiple different medical providers sometimes to recognize that these are all stemming from the autonomic nervous system. Autonomic disorders are often what we call invisible illnesses. So patients look fine on the outside. And in fact, a lot of the dysautonomias, and especially postural tachycardia syndrome, primarily affects young women who are otherwise very healthy, sometimes former athletes. And so people are like, well, you don't look sick. They are inherently mind-body disorders. So the autonomic nervous system mediates a lot of your physical responses to your emotions. You feel anxious about something, your heart starts racing, you get sweaty, you get a little short of breath. And because those symptoms can be seen in things like anxiety, a lot of times they get written off as anxiety. And so that can be challenging to identify and diagnose. It is inherently a multidisciplinary field. We've seen how the autonomic nervous system impacts pretty much every organ system, which means that multiple different medical specialists have to work together to optimally treat these patients. It's a younger field of study. So the American Autonomic Society, kind of one of our biggest organizations for research and clinical collaboration, It was only founded in about 1990 or so. So we are many decades behind some other medical subspecialties. There's a shortage of trained clinicians. There's only about 60 board-certified autonomic specialists in the country. There are more who treat autonomic disorders and can do that well even without the board certification, but still, we are woefully behind the demand. And managing an autonomic disorder requires very active patient participation. Managing an autonomic disorder, as you'll see as we go on, is really, it's a lifestyle change. You're having to think about it at multiple points throughout your day all the time. It's not like you can just set an alarm and take a pill twice a day. It really impacts many areas of your life, and that makes it very challenging. All right, so let's dive into the heart of the talk, which is entitled Tools for Managing Autonomic Disorders. And I would like to envision this in kind of two ways here. I've given talks like this many times to medical communities, and I focus a lot on the treatments for autonomic disorders. What are the things that you're going to use to tell your patients to help improve their symptoms? But I wanted to step back a little for a patient event and say, okay, well, from the patient perspective, from my interactions with patients and kind of what I've gleaned over the years, how can they think about it? What the ones that have done really well, what have they shared with me? And how can I build a framework for approaching the autonomic disorders? And then we'll fill it in with some of these practical tools as well as time permits. So we're going to start with the framework, the pillar of which is education. So many experts have said education is the number one treatment for autonomic disorders. And it's also a quote out of the Dysautonomia Project book, which I know is floating around here. So this is a bold statement. What do we mean by this? All right. So education for who? Well, for the patient, for the family and caregivers, and for the medical professionals, all has a role here. How does education help the patient? Well, first of all, it can help the patient understand their symptoms. Now, this can be really helpful on a couple of different levels. If you can understand where your symptoms are coming from and a little bit about the autonomic nervous system, you can start to identify things that make them better or worse. This can provide meaningful information both to you in managing your condition and also as feedback to your doctor. But also just the understanding, the naming, the identification of these are what my symptoms are and this is where they come from can sometimes just bring a little more peace. I understand what this is instead of just continuing this uncertainty and anxiety and, more and more medical tests and journeys. If I have a diagnosis or at least an understanding of where it's coming from, I have a little better sense of what the next step is and how I'm going to tackle this. Education can help patients implement lifestyle modifications. We, as physicians, will give you a long checklist of kinds of interventions to use, but tailoring them to your own life, if you kind of just understand the rationale behind them, it becomes more intuitive and more effective. Same thing with taking medications correctly. Some autonomic medications are dosed a little oddly, but if you understand how and why, then it makes more sense and it can be more effective. It helps patients become an active participant in medical decision-making. Again, these are very lifestyle impacting conditions. And a lot of times there's not a black and white. There's not, this is, of course, the treatment that is for everyone with this condition. No, there's usually a lot of give and take there. And so the more the patient understands, the more they can then communicate with their doctor and say, this is what I would like to pursue. This is the course of treatment that we should move forward with. And then when the patients understand, they can then share their knowledge with their family, their friends, and their healthcare team. All right, so how does education help the family and friends? Well, they can help them better understand their loved one's symptoms and really importantly, understand that the symptoms are quote unquote real. So often autonomic symptoms, whether it's because of their resemblance to some psychological manifestations or, the exercise intolerance. I don't feel like getting up and doing things. I don't feel well. Before there's any sort of medical explanation, even well-meaning family members can wonder, is it all in your head? Are you just tired? Are you lazy? No, if they understand the autonomic nervous system, then, they can become more confident in saying, hey, I get it. This is a sickness and I'm going to support them by doing X. They can be more mindful of limitations. If you want to go out with your loved one who has dysautonomia, maybe an outdoor concert, standing room only in 100-degree heat in the middle of August is, some of you know, maybe that's not the best choice. Or maybe if y'all really want to go to that concert, we're going to find somewhere for you to sit. We're going to pack a cooler full of really cool beverages. Like we're going to make this work. It can help inform an outside perspective. So sometimes it's really the patient is living with these symptoms all day, every day. Sometimes it's kind of hard to see trends and changes over time. And so if you have someone who understands kind of what you're going through, sometimes they can say, well, I've seen over the course of the last month, you're getting a little better in this aspect, or I've noticed that you've really struggled with this. That can be helpful. And sometimes they can be advocates in the healthcare encounters, not necessarily an adversarial type thing, but more just, hey, you should speak up. This symptom has really been bothering you. Don't be afraid to mention this to your doctor. Or, I've noticed, you want to be very positive about this medication, but it's been giving you some trouble. Bringing that up in the encounter can sometimes be very helpful. All right, and the healthcare team. Education, of course, very important for the healthcare team. On one end, to identify potential autonomic symptoms and refer or treat appropriately, especially in the primary care setting. The more our primary care physicians understand about the autonomic nervous system and autonomic disorders, the better they can identify and help patients get diagnosis and treatment faster. That's one of my favorite things about this recent residence course that we did through the Dysautonomia Project is a number of these very excited and eager medical trainees are actually going into primary care disorders. And so, they won't be doing autonomic medicine day in and day out, but they will be taking care of patients with a variety of concerns, and they will now be better equipped to pick up these symptoms and identify them appropriately early. Be mindful of autonomic problems when treating comorbid conditions. So, if I'm a general neurologist who has a patient with really bad migraines and they also have POTS and dysautonomia, there are certain medications that may be a better or a worse choice for them in the setting of their dysautonomia. So if I understand that, I can better treat my medical condition, which is the migraine. And then also being aware of common comorbidities with autonomic disorders. So if I'm a dermatologist and a patient with dysautonomia comes to me with hives, well, there are many things in the world that cause hives, but they have dysautonomia. I wonder if they have mast cell activation syndrome. So education, very important for all providers, not just autonomic specialists. All right, so education is really important. Where am I going to find it? The TDP website, if you have not already had a chance to go explore the website, I would really encourage you to. There is a wealth of information there for various levels of experience. There are videos, interviews with experts. A lot of my colleagues from the American Autonomic Society have contributed. The book itself, The Dysautonomia Project, I love this book. It is a really creative take on a patient manual. So it's double-sided. So the left-hand page is written for the patients and the right-hand page is written for medical professionals. And so they take topics throughout the book and they present it in two ways. It's a really cool way for the patient and the medical provider to communicate with each other. The principles of autonomic medicine Dr. David Goldstein at the NIH, one of the preeminent scientists in autonomic medicine, has written this ebook. It's now in version 4. It is freely available online. And it is also a mix of some very patient-focused introductory information and some really high-level biochemistry. So it has something for everybody. The American Autonomic Society website also has resources and directories of autonomic physicians around the country, and certainly your own doctor for whatever specific form of autonomic dysfunction you have can help guide you to the appropriate resources. So I hope these are helpful. Alrighty. I'm going to speed up a little here. All right. So the next pillar of the framework for approaching autonomic disorders is your medical team. So who is going to be part of this team? Well, a primary care doctor really needs to be a very integral part of the team. Sometimes that happens naturally because they're the ones who pick up on something and refer you or treat you appropriately. But even if that wasn't the first person that you went to, a primary care doctor is really important because the whole rest of your body is still very important to take care of, even if you have dysautonomia. That is not the entirety of your healthcare. The autonomic specialist doesn't know necessarily how to refer you for pap smears and such. Now, an autonomic consultant is also a really important part of your team. Sometimes, depending on geography and availability, they may not be seeing you very frequently. Sometimes they come up with a plan for you and send it back to your primary local medical team, and that's okay. We have to kind of adjust based on the availability. Other medical subspecialists for associated symptoms and comorbidities. So even if we know that gastrointestinal complaints are caused by autonomic disturbance, sometimes you just need a GI specialist specifically to manage those. They have kind of the best expertise there. So sometimes we have to build a team around the symptoms. Mental health professionals, please do not discount these. I have had some patients who have been hesitant because they've been misdiagnosed in the past with, your symptoms are just your anxiety. And so when I say, I think you may really benefit from seeing someone, they're a little hesitant. And they say, well, I've been written off before. If I go see someone, then everybody's still going to believe it's just my anxiety. No, having a chronic illness is tough on your mental health. And having a good team, and I'm so excited that we have Dr. Fry here to speak to us some more about that, I think is really important. Physical therapists can also be an important part of the medical team, both someone who's familiar with autonomic disorders so they can help craft an appropriate exercise plan or help with pain management and joint issues, very important. So what to look for in your medical team? Well, ideally, someone who's already familiar with autonomic disorders, but you know what? Sometimes you don't have someone readily available, and if they are willing to learn along with you, I have found some fantastic medical providers. Somebody's got to be the first sometimes. Someone who listens and someone you can trust. So you need to be able to build a therapeutic alliance with your doctor, again, because these treatment plans are very integrated into your lifestyle. You need to feel comfortable with this. So building that therapeutic alliance is really important. All right, the next pillar of your framework, your social support network. This will look different for everybody. Some people feel most comfortable with their immediate family. Some people feel more comfortable with close friends. Some people love connecting with other patients who have dysautonomia. Some people are more private and they're like, I don't want to talk to strangers about my symptoms. So whatever it looks like for you and your personality is fine, but you need one. You cannot do this alone, and you shouldn't try to. And just like we were saying earlier, you need people you can be real with. You need someone that they say, how are you? And you're like, I'm not doing so well today. And you need to not have to be afraid that they're going to think that you're boring or dramatic or no fun, or they're going to get offended that you can't go out with them tonight. People who are going to extend you understanding and grace and walk with you through this. And finally, attitude and outlook. And I certainly don't want this part to sound trite or anything. We all know that, if there's a challenge in life and you can hit it head on with a positive attitude, that's helpful. But dysautonomia is hard. And that's not going to work 100% of the time. And so learning to give yourself grace, both when you're struggling mentally and when a lot of autonomic patients used to be really type A and really high achievers. And I don't actually not used to be. I mean, they are. They're used to being able to accomplish and do a ton. And so they're still in that mindset. And it can be so discouraging when they've suddenly had some physical limitations imposed upon them. But learning to give yourself grace and learning to, work through these and then find that you can still have a good and very active life. It just looks a little different than it did before. So learning to give yourself that grace, I think, is an important part of the journey here. Taking care of your mental health, whatever that looks like for you, whether it means having a trusted mental health provider, whether it means, just having friends that you connect with, or, just saying, today I don't feel good. I'm going to have Netflix and pajama day. And I'm going to be okay and not beat myself up about that. Whatever it looks like, taking care of your mental health is really important. And most importantly, hope that things can be better. Knowledge that you have a community of people who are supporting you here at TDP, if nowhere else, but hopefully also very, very locally to you. And there's a really active group of scientists and clinicians out here who are passionate about making things better for patients. All right, so very quickly, we'll touch on some practical tools. There are a lot more resources about this on the TDP website, actually, and in the book about kind of these very practical treatments. So data is an important tool in autonomic disorders. It can take a variety of manifestations, symptom diaries, symptom profiles. I just heard about this new patient assessment today, and I'm very excited for that. I think it's going to be a great tool for patients and physicians to communicate. Taking vital signs. If your doctor has you asking you to take your heart rate and blood pressure at certain times of day in certain positions, just making sure that you have that just as they're asking, because sometimes we're looking for very specific trends over time, and that can be helpful for us. Information from wearable devices like Apple Watches, Fitbits can be helpful. I take them in context. They're still a technology in evolution, so we've got to put them in the clinical context as well. And medical records. More and more, we have patients having access to all of their medical data through patient portals. And I think that's great. It can really help with communications between medical providers, specifically if you're trying to gather kind of a binder for yourself, things like progress notes, discharge summaries, labs, especially labs that are only kind of checked one time and maybe unusual or expensive. So we just have access to those and aren't always having to reinvent the wheel. And results of imaging studies and procedures, including images on discs, if you can get them, can be very helpful and just expedite these processes when you have a new medical encounter. Then treatments. Treatments are roughly broken down into non-pharmacologic, meaning not medicine, and medicine. So non-pharmacologic measures are actually the mainstay of the management of autonomic disorders. This is kind of an overview of them. It's an awareness of exacerbating factors, hydration, boosting blood flow to the brain, and in many cases, some form of an exercise protocol. That's not a one-size-fits-all. But learning to recognize situations that can worsen orthostatic, meaning standing symptoms, and anticipate them or mitigate them. It doesn't mean that you can't do any of this stuff, but just kind of being aware, this might be a little tricky. This is how I'm going to prepare for it in advance. So morning time can be very tough for patients with autonomic symptoms. You've been horizontal all night. You haven't been drinking all night. You're relatively dehydrated. Sometimes patients, arrange their class schedule later in the day, or they plan for whatever sorts of active exercises that they're going to do later in the day. Large carb-heavy meals can be rough, so smaller meals with kind of a lower carb index throughout the day can be helpful. Alcohol dilates blood vessels. Anytime blood vessels are bigger and blood is going elsewhere other than the brain, it can make symptoms worse. So, being mindful of that. The heat can be rough. Hot weather, hot showers, again, dilates blood vessels so that your body can radiate off the extra heat. But that's blood that's not going to your brain. So again, just being mindful and preparing. And then exercise is great, but right after exercise, all that blood is going to your exercising muscles, not going to your brain, can make symptoms worse. Fluid and salt. We encourage our autonomic patients to increase their fluid intake 2 to 3 liters per day, generally speaking, and salt up to 7 to 10 grams per day if there's no medical reason why you shouldn't. And just for reference, 1 teaspoon of table salt is 2.2 grams of sodium. Salt is so much fun if you like salty foods. I know some people don't, and I don't understand that, but however you can get it in, I really encourage people to get it in through food more than trying salt tablets. They don't work as well and can have some side effects. Electrolyte drinks. I'm actually very excited about our Zappy hour with I'm going to sample some electrolyte drinks. Traditional sports drinks often have a lot more sugar and a lot less sodium though. So just kind of looking at the nutrition label and looking for the really high sodium drinks is more beneficial here. Bolus water drinking. So if you can drink a whole bottle of water in the setting of about 5 minutes or so, it can really boost your blood pressure in terms of autonomic failure, or can kind of settle out the standing fast heart rate in forms of POTS and dysautonomia. That's a nice trick for when you're about to get up and do something. Chug a bottle of water beforehand and go about your way. Elevating the head of the bed, putting blocks under the head of the bed is a helpful way to adjust the hormones in the body that manage the blood pressure and the fluid retention. It's especially important for patients with autonomic failure, but it is theoretically applicable to POTS and orthostatic intolerance as well. And I do encourage my patients to at least give it a try. Some find it very helpful. Counter maneuvers. So when you're feeling faint and you just really got to have something that can give you a little boost for a little bit so that you can find a safe place to sit down. Crossing the legs, squeezing the gluteal muscles, clenching the fists, things like that can give your blood pressure just that little bit of boost so that you can gracefully go find a place to sit rather than getting down on the floor right away. Compression garments do have to be thigh high or waist high to be beneficial. We are in Florida here, and I am from Texas. I am a realist. I don't even recommend them to some of my patients in the summertime. An abdominal binder can be helpful, though, without being quite so hot. So it can provide some abdominal and pelvic compression. Some of my ladies get away with tight shapewear and actually find that that's very, very helpful for them. Exercise. I'm a huge proponent of exercise, in part because I trained at UT Southwestern and the IEM, where most of this, or a good chunk of this research was done. It's been very well studied, particularly in postural tachycardia syndrome, because there are differences in the heart of POTS patients, and the exercise protocol itself can actually change the physiology and reverse some of those findings. They've actually done a study that showed it had a better quality of life improvement than one of the most commonly used medications, the beta blockers, and that it is feasible in a community setting. So you don't have to have the exercise physiologists and the research scientists guiding you every step of the way. This is something that can be done at home. But some notes. First of all, recommending an exercise program is not telling you you're just out of shape. You need to get out of bed and work. Some people hear it that way, probably because they've been told that along their journey, unfortunately. It's a medical prescription to help you be better. The kind of exercise matters too. Throwing somebody with dysautonomia on a treadmill is
not helpful and is not going to last very long, as many of you are probably very aware. Graduated recumbent exercise, so horizontal exercise, meaning rowing, recumbent biking, swimming, targeted to heart rate, lower body and core strengthening to improve blood flow return to the brain. There are multiple published protocols available, and certainly it needs to be tailored between you and your doctor and you and your physical therapist. The first 4 to 6 weeks, if you have been prescribed an exercise protocol, that first 4 to 6 weeks tends to be the hardest. Symptoms can worsen before they get better, but I really find that patients who can get over the hump are glad that they did. Fatigue in general may not improve, but I'm so glad that Dr. Klimas is going to talk to us later about this, because I do find fatigue to be a very challenging symptom, and it sounds like she's really an expert here. Post-exertional malaise may be limiting. That's, again, something that may need to be adjusted between you and your doctor. And if you have joint issues, then a physical therapist can really be helpful in modifying the protocol. I'm a huge proponent, though, of something is better than nothing. This is a marathon, not a sprint. I have had patients who literally started with 1 minute a day and were able to build up to 20, 30 plus minutes a day and felt, better doing it. So whatever you can do, that is your starting point. All right, I am running out of time. I am going to skip over the medications and just go straight to conclusion so we have time for a couple of questions. So in conclusion, autonomic disorders are hard, but there is hope. I hope that this gathering here and just knowing that there are experts working on it and a supportive patient and education community is hope inspiring for you. Dealing with an autonomic condition, you've got to build your framework first. You need some education, you need a medical team, and you need your social and emotional support network. Use your practical tools, gather your data, use your non-pharmacologic measures, medications as prescribed by your doctor, and just know you are not alone. That is my thought.
Do you use any electric stimulation for vagus nerve as a treatment?
I have not yet, but I have heard the research in that area, and I think it's interesting. It's definitely an interesting concept.
Can you just touch on medications just really quickly? We had to kind of skip over that, so go ahead.
Absolutely. Medications, I think very broadly, medications to squeeze the blood vessels. So that's usually something along the lines of mitidrin to raise the blood pressure. There is medicine to hold on to fluid. So that's usually looking like fludrocortisone. It helps you retain salt and fluid. Medications to slow down heart rate, beta blockers or ivabradine. They work by slightly different mechanisms. Medications to tamp down the sympathetic nervous system a little bit. So looking like clonidine, guanfacine, and medications to increase acetylcholine levels, which improves overall autonomic transmission and especially increases parasympathetic function. Often we use pyridostigmine for that. Those are my top line medications. And very importantly for medications are tailored to the patient and they are for symptoms. We don't have a medication that just fixes the autonomic nerves. If we did, I guess I'd be out of a job, or I'd just be like writing prescriptions for it all day long. They're for symptoms, and so they're very individualized to the patient. What are your particular symptoms of autonomic dysfunction and how will we approach them?
Because you mentioned that a lot of people are very, very smart here that have dysautonomia. How do you prevent doing what every human being will do, getting your mind racing before you're hitting these steps one step at a time, and then condemning yourself before you even have a chance to be healed?
Oh, I think the therapeutic alliance, finding a trusted medical professional, the symptoms of dysautonomia can be really scary. I actually was dealing with a guy just in the last couple of weeks that he was convinced that he was dying. because he had these recurrent episodes. His heart rate would go fast and it would go slow and he would be fainting. And I mean, it's not just him. I've had multiple patient encounters like this. And he was afraid that he was going to drop dead from these. And it was fainting. He was having vasovagal syncope, and vasovagal syncope can be terrifying. And yet it is not in and of itself, generally speaking. It is considered to be a benign condition that is not, in fact, life-threatening. And so having a trusting relationship with your doctor and being able to trust that when they say, I know these are scary symptoms. I have seen you have had the medical workup. This is a benign condition. I mean, I've seen scenarios like that for sure.
Okay, you got time for another question here? Running. Go ahead.
Hi, can you speak for just a moment about hyperadrenergic POTS and how some of the recommendations are contraindicated?
Well, I don't know about contraindicated per se, but it gets back to treating the individual patient and their symptoms. And so in somebody who has a lot of hyperadrenergic symptoms, then we're going to reach for treatments that try to specifically address those symptoms. So things that can reduce sympathetic activity, sometimes using things like guanfacine or clonidine can be helpful. Sometimes with hyperadrenergic POTS, sometimes there's an association with the mast cell activation syndrome. So while you might want to use beta blockers to slow down the heart rate, that can worsen mast cells. So again, very individualized to the patient.
Next question. We're gonna go. I'm gonna make an executive decision to go 5 minutes longer on this section. Next question. Did you have one?
2 screens back when you were flipping through, I saw the word guanfacine. Tell me how guanfacine is useful in dysautonomia or POTS.
So guanfacine works on the alpha-2 receptors. They are part of the sympathetic nervous system, but they're kind of a negative feedback aspect. So if you activate the alpha-2 receptors, it tells the body to decrease the sympathetic outflow. And so it can be helpful in hyperadrenergic symptoms or with really high blood pressures sometimes.
Next question. Anybody? We got one right here. Quick.
Yes. Do you recommend pharmaceutical holidays for any patients, and why would that be the case?
Sometimes, not as a matter of course, but occasionally I will have patients who have come to me who over time, so many medications have been added. One medication was started for a very good reason, but then another got added, and then one got added to treat a side effect of another medication. Sometimes I have peeled these back. Certainly not just a cold turkey thing and not just you've been taking meds for a long time, so we're just going to stop them for the heck of it. But in some cases where I can tell that things might have just grown with the medications, I have definitely spent time peeling back.
Dr. Thank you so much for your time. We appreciate you very much.
Thank you.
Thank you, my dear.